Kathleen Bristol, a nurse at the Georgetown Hospital for over 18 years, is speaking out against what she terms as the highest degree of secrecy surrounding her brother's recent demise.
I refuse to accept that my brother died from COVID-19. I refuse. There is no way, no how.
The woman's brother, 45-year-old James Harris, a father of 5, lost one of his legs to diabetes early last year. Months after that, his scrotum began swelling as a result of fluid accumulation, and he was diagnosed with hydroxyl in mid-August of this year. Bristol, during a sit-down in our studios on Monday, explained that after Harris was diagnosed, he began experiencing complications and was rushed to the hospital on a number of occasions. He was finally admitted to the Mill surgical ward after doctors recommended that he undergo a surgery. Bristol is alleging that during her brother's hospital stay, he shared a ward with a suspected COVID-19 patient.
About 2 days after they were in there together, he said, my sister, look, I see these dress-up people come. That's the COVID-19 team. And they took the guy away. Then they came back to inform him that the patient would have tested, his results was pending, it came back positive. And so they would have to do a test on him. They took that test on him, and the very next day they discharged him to go home. He did not really receive the results as yet.
Bristol claims that on September 15, the man was admitted again to the COVID-19 isolation facility as he was experiencing shortness of breath, along with other diabetic complications, and was later transferred to the infectious disease hospital at Lillian-Dahl. Last week, Monday, he was referred back to the Georgetown Public Hospital COVID-19 intensive care unit. Still in contact with Harris, Bristol said he informed her that he was in dire need of water and bed sheets, but she received a hassle to get the items to her brother.
My expectations are that you're supposed to have these things, these necessities. And then when the relatives come, they're not being admitted into the compound, much less to go to the back to hand the things over to whoever.
On Friday, while on duty, she received a call from health officials informing her that Harris had died. Upon heading over to the intensive care unit, she claimed she was told by doctors that the body was already taken to Memorial Gardens Funeral Home. She is contending that nothing was done to treat Harris's underlying conditions.
He was diabetic, his pressure, sugar was high, because I got inside information since at Lillian-Dahl, the sugar was high. The pressure was high. My brother was never a pressure case. That was caused from the fluid retention. They did nothing to alleviate those problems, nothing. I can tell you because I was at the mortuary Saturday morning, I examined the body. There is no mark, they did no tapping, nothing. Nothing. He was just left to die. His jugular vein is severely swollen, which tells the story of oxygen hunger.
Interestingly, Bristol informed this newscast that the family was able to retrieve her brother's body from Memorial Gardens and the family will be handling the funeral proceedings. However, this is not a norm for patients who die from COVID-19. According to the Ministry of Health's protocol, patients who die from COVID-19 are kept at Memorial Gardens, which is the primary funeral home for that purpose. The grieving woman says she is disappointed in the royal runaround she was forced to face, even as a staff at the hospital. She is adamant that even if her brother was positive for COVID-19, he contracted it during his stay at the hospital. She's hoping to get the much-needed answers and closure from the relevant authorities. Shalana Providence, head of strategic planning and communications at the Georgetown Public Hospital, when contacted on the issue, said she has not been apprised of Harris's case at the time. However, she informed that an investigation would be launched into the matter. Efforts to contact Deputy Chief Medical Officer Dr. Karen Gordon Boyle proved futile. Temika Rodney reporting for the HGP Nightly News.